Good afternoon and good morning to everyone on the West Coast. This is Delaine Henry, CEO of Advanced Hospice Management. I see that we have some people signing on, so I want to give a few minutes for everyone to join, have the opportunity to get logged in before we get started. So I just want to give a little introduction for those of you joining us for the first time. Advanced Hospice Management is a hospice-only third-party billing solution. We are geographically dispersed in billing and in clients. So we have clients across the country and in Puerto Rico, and our billing staff is also dispersed across the country, which gives us the advantage of having a lot of experience in all of the different MACs for Medicare and many different state Medicaid and managed care programs. All of our clients are given a primary biller for their account, which means they develop a great relationship with one person who handles their billing. But all of our clients have a team of billers as a backup, so there's never any disruption in your billing processes or cash flow. We are always available to our clients, and I think that customer service, above all, is our number one goal, to service our clients in a manner that allows them to do business on a daily basis. And we also currently, all of our billers are up to date on the most recent education as far as hospice billing and rules and regulations go with regard to billing. And because of all of that, we're able to maximize collections for our clients. And that is really the goal for us, is to provide a service to hospices that allows them to care for those patients in the community, which of course is the goal of hospice. If you guys have any questions about our services at all, I would be happy to talk with you on email or phone call, and my contact information is attached to the back of all of our webinar handouts, which will go out to all of the attendees once the webinar is concluded. So let's get started with our program today. Let's see why I cannot flip slides. Sorry, guys. Okay, so this is the information that I just went over, and again, you guys will receive this handout after the webinar concludes, and of course you can always contact us. Our information will be on the last slide. So today's topic is the new Medicare Beneficiary Identifiers, which are rolling out April 1st, 2018. And what we've done here is try to put together an all-inclusive list of the transition and how it will happen, what CMS has for us, and what we can do as providers to prepare. So why the transition? I've had this question asked a lot, and really and truly what it comes down to is it's a HIPAA issue, but it's also a patient privacy issue in the respect that Social Security numbers are used now more than ever to steal people's identities. And unfortunately, the elderly are at very high risk for that kind of theft and illegal use of the Medicare number, which is, for most people, their Social Security number. So again, we talk about MACRA of 2015, and that has required Medicare to remove the Social Security number from all Medicare cards by April of 2019. So a new number, which they now call the Medicare Beneficiary Identifier, will replace the Social Security number-based health insurance claim numbers on the new Medicare cards. CMS is taking this step again to protect people with Medicare from fraudulent use of Social Security numbers. The process for making this transition. So the Social Security number removal solution will provide the following capabilities, and these, of course, are capabilities of Medicare. So they will generate Medicare Beneficiary Identifiers for all beneficiaries. So that's an important point, because that will include existing, which is currently active, but also deceased and archived Medicare beneficiaries. And of course, anyone who's new to Medicare as of April 1 will just be issued a new number. They will not have the old Social Security-based number. New cards will contain the MBI, and of course will go to existing and new beneficiaries. There will be modifications to the Medicare system, all of the MAC systems, and business processes, which of course mean that we have to make sure that all of our vendors are up to date and ready to accept these numbers, and that we can transmit them successfully to our MACs. CMS will use this MBI generator to assign 150 million MBIs, which I think is just incredible. And again, 60 million active and 90 million deceased are archived. And the reason I point that out is because you will no longer be able to look up the Medicare patient by their old Social Security-based number as of January 1 of 2020. So in the event that you have to go back and look at old claims, you would need to have that new MBI. But the good news is it's easy to get. Let's see. And of course, if a patient is issued an MBI and it's compromised for any reason, Medicare will issue them a new one, which might cause some confusion. What providers can expect. CMS will begin mailing new cards in April of 2018 and will meet the congressional deadline for replacing all Medicare cards by April of 2019. They are going to remove the gender and signature line from the new Medicare cards, and the Railroad Retirement Board will issue their new cards in the same manner as Medicare, so their beneficiaries will just get their card from Railroad Board instead of CMS. CMS will work with states that currently include the HIC number on Medicaid cards to remove the Medicare ID or replace it with an MBI. So that information should go from CMS to your state Medicaid. So if you guys are aware that your Medicaid program uses the old Social Security number-based Medicare number on their cards, then you should be on the lookout for a change there as well. So here's the schedule for mailing, which they've really not been very clear about except for the first couple, as you can see. Wave 1 and 2, we can see April through June of 2018, and everyone else, it just says after June of 2018, which really doesn't help. But I'm sure this will be updated, and again, we'll give you some links to CMS and to the different MACs where you can monitor these updates and changes so you can be more prepared for the mailings in your area. So here's the full plan of the transition. And as you can see, a lot of things have already taken place, mostly to do with notifying us as providers, getting a lot of information out to patients and beneficiaries. I'm sure you guys have seen the commercials. And right now, what we should be doing is preparing and testing our systems, which means making sure that our software vendors and our clearinghouses are capable of accepting the new numbers and getting those numbers over on clean claims to our MACs. In April, of course, we'll start seeing the new numbers issued to patients. In June, we can expect the provider lookup tool, which is great, and we'll talk a little bit more about that. In October of 18, the new numbers will actually appear on our remittance devices from Medicare. So if you submit a claim with the old Medicare number, you will get back on the remit a new MBI. So it will have both the number you submitted with and the new number. If it's been assigned to the patient, you should have that on your remit, which is a great resource as well. April of 2019 is the deadline for issuance of all new Medicare cards, and January 2020 ends the transition, and everyone at that point has to be using the patient's MBI for billing and any other Medicaid dealings. So what will the new number look like? I get that question a lot as well. It will still be 11 numbers, which, if you guys remember, the number we use now can be 11 or 12. So the new number will be 11, but it will be very distinguishable from the old number because it contains uppercase, alphabetic, and numeric characters, but they'll be in different positions than what you're normally used to seeing with the Social Security-based number. It'll be unique to each beneficiary, which I think is a point everyone needs to understand. So the husband and wife will be issued completely different numbers. They will no longer be associated with each other or in any kind of sequential order. So each person will have to provide each agency with their own unique ID. It'll be easy to read, and they've limited the possibility of letters being interpreted as numbers. So alphabetic characters are uppercase only, and will exclude S, L, O, I, B, and Z. So that should make it easy so we don't mistake any letters for numbers or the other way. They will not contain any embedded intelligence or special characters, and they will not contain inappropriate combinations of numbers or strings that may be offensive. CMS anticipates that the MBI will not be changed for an individual unless the MBI is compromised or other limited circumstances still undergoing review. So once they have their MBI, it should stay. So this is what it looks like. Here's your old Social Security-based HIC number, and they put the dashes in just for effect. Obviously, we don't use the dashes in either of these numbers. And as you can see, the MBI looks totally different. So in the MBI, again, there's letters and numbers, but there are some characteristics that will remain the same. Some of these locations will only have letters, and not that that really means anything. I mean, the most important thing for us is that we can recognize the difference between an old number and a new number, and that you get the correct new number from your patient or through one of the other sources like the portal or eventually from your remit. So again, this just explains the difference. And this is what I'm saying. In the new Medicare Beneficiary Identifier, the key positions 2, 5, 8, and 9 will always be alphabetic. So if you go back here and you look at this number, position 2 is an E, position 5 is a T, 8 and 9 are M and K. So those will always be letters. So again, during the transition, which runs April 2018 to December of 2019, CMS will complete its system and process updates to be ready to accept and return the MBI on April 1 of 2018. All stakeholders, which is anyone who does business with Medicare, submits claims or reports of any kind, you will modify your process and systems to be ready to submit or exchange the MBI by April 1. Now, we may submit with either the MBI or the HIC number during the transition period. So we have a good while of being able to continue to submit with the old number. But of course, the longer we do that, the longer we're using the patient's Social Security number and giving them unnecessary exposure. CMS will accept and use for processing and return to stakeholders either the MBI or the HIC number, whichever is submitted on the claim. And CMS will actively monitor the use of HIC numbers and MBI during the transition period to ensure that everyone is ready to use MBIs by January 1, 2020. So I pulled this off of another slide, and I thought it was just important that, to make the point again, that in October, you will be able to get that MBI from your remit. So if you're submitting a claim with the old HIC number, you will get the remit back and it will have the new MBI on it. So that's a great resource for getting these numbers. Eligibility alerts. So when we run eligibility through the HET system, it will return a message and let us know if CMS has mailed that particular beneficiary's new card. So that's an alert that tells you, hey guys, we've submitted the card or sent the card to the patient, so be on the lookout for that information. And again, some of this at the bottom is technical, but it is telling you that in October, of course, the same thing. This is where I pulled that last slide. The remit will include both the HIC number and the MBI. And this is just some technical information about where in the loop in the segment you will see that information. So starting in June, the MACs are going to give us a portal to be able to look up your patient's MBI if the patient can't provide it to you. So I'm assuming that the secure portal will be part of our online provider services or NGS Connects and MyCGS, the MAC portals that we already have is what I assume they will add this particular lookup to. So you will be able to look for that patient's MBI in the portal if you have your patient's first and last name, date of birth, and Social Security number. If the patient does not want to give you their Social Security number or the family member, they can go to mymedicare.gov to get their MBI. And of course, your railroad benefits, if your Medicare patients with railroad benefits need a replacement card, they can get that through the Beneficiary Contact Center or log into rrb.gov. Impact to other payers, and we talked about this a little bit. For For state Medicaid agencies, Medicare will give those Medicaid agencies the new MBIs for all Medicaid eligible people who also have Medicare. And they'll give that to our Medicaid services before they mail the cards. Railroad benefits will continue to send cards with the railroad benefit logo. And you can't tell from looking at the MBI if beneficiaries are eligible for Medicare, because they're railroad retirees. Beginning in April 2018, we'll return a message on the eligibility transaction response for a RRB patient. The message will say Railroad Retirement Medicare Beneficiary. Medicare providers must program their systems to identify RRB beneficiaries so they know to send claims to the Specialty Medicare Administrative Contractor. Impacts other payers continued for private pay. It says for non-Medicare businesses, private payers won't have to use the MBI. They'll continue to use whatever that supplemental insurer's unique number is to identify those customers. In addition, CMS is working to develop capabilities where providers will be able to access a beneficiary's MBI through the lookup. Again, it's the same thing we just talked about. The portal will be really important, so you want to make sure you have access to your MAC's web page so that you can log in and look at you can actually get paper remits there. So if that's where you need to find those after October 1, you can pull down your remits and get your MBIs for any patients you've billed with a HIC number. And you can also use the new portal as of June to look up those patients with the information previously provided. So after the transition, beneficiaries, providers, and plans will no longer use the HIC number for internal and most external purposes. Now, there are a few exceptions, and they're listed here. With appeals, you can use either the HIC number or the MBI. And for that, I'm assuming they mean for appeals with dates of service prior to January 1 of 2020, where you may have submitted claims with the HIC number. Adjustments, now this is for other types of systems, drug data processing, risk adjustment processing, and encounter data, coordination of benefits, and all records, not just adjustments. So that's saying you can use the HIC number indefinitely for some systems. I don't know if that means you may also be able to use the MBI or if they'll accept both. For reports, they'll continue to use the HIC number until further notice. This, I think, will change, obviously, by the further notice part. Maybe they just haven't had the opportunity to update all of these systems, because I'm sure they were focused on updating the claims part of the system in the common working file first. But for incoming to Medicare, when it says us, they mean Medicare, quality reporting, disproportionate share, hospital data requests, which of course are not hospice related. But for outgoing, for PSNR reports, that is hospice related, those will also contain HIC numbers. Fee for service claim exceptions, again, the appeals, the claim status query, and you'll use your HIC number or MBI to check the status of the claim as long as your earliest date of service is before January 1, 2020. For hospices, of course, we bill monthly, so once we submit those December claims, we should not go back and use the HIC number for claim submissions. I think they're talking about claims with span dates, like for home health, where you may submit the first part of a claim prior to January 1, 2020, and then submit the final part of the claim after. It says you can still submit with the HIC number. And then, of course, for premiums, patients who actually mail premiums, they're saying, of course, they'll accept your payment with the HIC number. So that's for patients more than it is for providers. Okay, so what providers need to do and know to get ready for the new MBI. And this, I think, is really the most important part of this webinar, is to make sure you're subscribed to the weekly MLN Connect newsletter so that you get updates and new information from your MAC and from Medicare. And to verify your patient's address, because, of course, this is where they will mail the card for the patient with the new MBI. And they are mailing those cards to the address on the common working file for that patient. I'm sure we've all experienced where we enter a patient claim and the address auto-populates with something different than what we have for that patient. So that is the most important thing, is to make sure that the common working file is up to date. And the patients can go on the website, or they can contact Medicare to update their information if they need to do that. And of course, this is just another reminder that Medicare will never contact a patient and request personal information, and they should protect their new Medicare number like a credit card and only share it with trusted providers. And again, that's just a way to protect our patients from any kind of identity theft or fraud. So again, for us to get ready to use the new MBI format, we want to double check with our software providers and with our clearinghouses and make sure that the system can accept the 11-digit alphanumeric MBI. We know they can accept 11 digits, but will their system allow you to put letters where it may not expect letters? So you definitely want to make sure those things are, if not ready, that they're in the works and will be ready for April 1. And this encourage practices and healthcare facilities to visit our website at cms.gov/newcard. That is where I pulled all the information for this webinar along with a few other resources, but they have great information there and it's updated. So as things change and maybe that list of rollout for the mailing list is updated, it will appear there. So it's a great resource for all providers to keep up with the progress of this transition. And you also, again, want to be sure you're signed up with your Mac so that you can access the portal through the Mac and check the MBI numbers if you can get the information needed from your patient. That portal should be live in June of 18. So key points, again, providers need to be ready April 1, systems and business processes. There's a 21-month transition period. There's 3 ways you get the new MBI, whether it's from the patient, from the remittance, or through the secure portal. Again, make sure you get with your patients and update their addresses. Providers have resources you can use when you talk to people at Medicare or with Medicare about the new cards. And you definitely want to go to this website. There are a few references of resources that you can actually purchase. Things like tear-off pads that have little handouts for your patients, and you don't necessarily have to purchase them, but it's a great template to look at the information you want to share with your patients about the new Medicare numbers, and you can maybe make your own, print them off, and just have your staff deliver them to each of your clients. And again, this is the website for the resources, and that's where you can print and order those forms if you need handouts for patients. And again, it's great education. So it's got all the links, and anybody in your agency who wants to know the progress of this transition can certainly get all the information they need from that cms.gov/newcard website. So again, the MLN matters for the transition is this one, 909365, and that is the direct link to it. So when I send out this handout, you can copy and paste it to your web address and just go over to that page. It should come up as a PDF. If for some reason you have trouble, let me know. I'll send it to you. But that really was a great outline of all of this information that I've included today, and it comes straight from Medicare. And then, of course, the new card for providers is another link to give you more information and resources for the transition. So that is everything we know about the new MBI. So I'm not sure if anybody may have questions. I'm going to go to my little question box now. Oh, I see a couple. Let's see. Hold on. Okay, yes. Somebody's just asking about the slides, and yes, we will most definitely email these out to all of our attendees, so everybody will have this slideshow, and you can share it in your office and make certain that everybody is aware of the resources available through CMS and through our MAC regarding this transition. And initially, when Medicare announced this, there was very little information, and I think it was kind of scary as a provider to think that we're going to have all new Medicare numbers, and how will this take place? When will our patients receive their numbers? When do we have to use them? And they've answered all of those questions for us. And it does appear that it's a pretty easy process for a transition, and they've made the MBI numbers easy to get, even if we can't get them from the patient, which I know sometimes is a challenge. We now have other resources, so we can get them from this portal, and we can also get them from the remits starting in October. So I don't see any other questions, guys. If anyone has anything, if you would type it in, and I'll answer that question for you. And if you type in something, and as we're closing out the webinar, we still get those questions, so I can answer those on email if you have anything else that comes up. And of course, anytime you guys have questions, my email is always available, and you can call us, you can email us. We're happy to help in any way that we can. And of course, if you have any other billing questions, we're happy to do that too. Let's see, where can I find the info to pass to our patients again? Okay, that info is on this slide. When you go to www.cms.gov/new-card, there's several links, and there are some resources that you can purchase, like the tariff pads, and there's posters and different things like that. If you have trouble finding that when you get to this page, there's just some, a list of links, but if you can't find it, let me know, and I'll be happy to send you that exact link. I should have included it, but it will give you options for things to purchase to hand out to your patients and to post up in your office to share with everyone that works with you, to make sure everyone is aware. And it's a great tool, I think, to train your staff to start looking for those new MBIs, letting their patients know to be looking in the mail, expecting something from Medicare. And that way you guys can get your numbers immediately and start at least putting them in the system and billing with them. And we have lots of time for transition, so if there are any issues or errors, of course, we have plenty of time to work those things out, whether it's with Medicare or with our vendors. So I think the sooner the better is definitely the way to go. So I don't see any further questions, guys. So I appreciate everybody joining us, and I will make sure that this slideshow gets out to everyone today. And again, if you have any questions, or whether it's about this or any other hospice-related matter, please let me know. This is my email address, dh@hospicemgmt.com. You can call us at 888-737-3585 anytime, and I will most definitely return your call. So please let us know how we can help. And again, thanks for joining, and I hope you guys join us next month. Be on the lookout for our newsletter about mid-month, and then the webinar will follow the last week of the month. Thank you. Have a great afternoon. Bye-bye.